station that's got you covered. This is the Fox 13 10 o'clock news.
It's time to stop the snoring. As many as 9 out of every 10 of us aren't getting a good night's rest thanks to a medical condition. But there's good news, and it's much easier to treat. You probably heard of it. It's called sleep apnea, and there's a new way to treat this. Dr. Joe shows us the tiny device keeping airways open all through the night.
Just looking at Carol Orenstein, you'd never guess she once had a snoring problem.
I would wake up in the middle of the night gasping for air.
4 years ago, a sleep study showed she had severe sleep apnea, causing her to stop breathing a lot.
I just knew over the long haul it couldn't be healthy for my breathing to be cut off several hundred times a night.
Carol's only hope for a safe good night's sleep came with this device. It's called a CPAP.
And this is how you sleep all night long.
The hose connects to a machine like this and provides continuous high-pressure air.
The tissue, your soft palate, your uvula, your tongue, those muscles and tissues are all going to relax, get floppy, so when you fall asleep at night, you're not breathing.
Dr. Glenn Adams is a sleep specialist at Sarasota Memorial Hospital. He says no question CPAPs work, but do have drawbacks for many patients.
It tethers you to a machine that you have to wear. It's cumbersome, it's bulky, it blows air in your face.
But about a year ago, Carol was offered something new. It had no hoses, no mask, and it was so tiny it fit inside a pocket.
I was like, oh, I hope this works for me.
It's called ProVent.
This is how ProVent comes packaged.
The small plugs fit into Carol's nostrils and work much like a CPAP using one-way valves, where breathing in is normal, but breathing out is not. When you exhale, ProVent partially blocks airflow.
You get a back pressure that's generated. That back pressure transmits to your back of your throat, and it acts as CPAP.
Enough pressure to push away floppy tissues that would otherwise block the airway.
You can just feel yourself breathing. You hear yourself breathing.
Carol said it took a little time to adjust, but the switch to this anti-snoring device is helping her get some much-needed rest without all the bulky equipment.
It's not that CPAP didn't work, but the ProVent is just better, and I do feel better.
ProVent costs about $65 a month, and it's not covered by insurance. It can only be used for obstructive sleep apnea. That's the most common type. And remember, sleep apnea can also happen in children, sometimes due to large tonsils blocking the airway. That lack of sleep in a child can cause behavior problems, and it's even misdiagnosed as ADHD. Bottom line, if you or your child might have a sleeping problem, talk to your doctor. I'm Dr. Joette Giovinco, Fox 13 News.
And here's why that's important. Dr. Joe says sleep apnea is best diagnosed with a sleep study, and therapies like ProVent are available by prescription. Mark?